Much for speaking with us here on CTV News Channel. Appreciate it.
My pleasure. Thank you.
So you are raising a very important point, and what you're saying is it's important for some sort of visitation to be allowed when it is considered to our seniors, something that I think the entire country, many people across the country would be speaking of. But how do you think that can be achieved at a time when the seniors are most vulnerable?
Well, I think we have to recognize that it's going to be what we call the new normal. And I think we also have to recognize the new normal is probably going to be in place for at least a year. And that's when you realize the new normal cannot consist of nobody can ever visit anybody in a care home for over a year. We have got to find a way, and I think we can find a way, to allow some visits to care homes. We can take precautions. We know that we are not going to return to all the grandkids are able to come in for the birthday party. But I think we need to look at how spouses are going to be able to visit their husband or wife in the last year or years of their life in the care home. I think we're going to have to look at how can we safely allow some adult children to be able to visit their mom or dads. I think it's going to depend on when it's the right point in time, where we are in our pandemic in our respective provinces, or even in a particular region within a province, and look at what are the kinds of safeguards that we can take. I think we can look at things like visiting only your loved one, nobody else, screening people when they come in, making sure that absolutely they don't have any sign of any illness, requiring a face mask so that whatever droplets they have don't contaminate the care home. I think there are ways, obviously limiting very much the number, potentially limiting the frequency. I think these are the kinds of things we need to start thinking about. It's been about 7-8 weeks now that we've had these restrictions in our care homes. And my office hears from many, many family members who want to find a way to safely do this, because you're quite right. We know from what we see in our care homes that if COVID-19 gets hold in a care home and spreads, once it starts spreading and gets out of control, it is very, very, very tragic.
Indeed.
So we have to balance, but I think we have to try and find a balance.
But, even today, for example, BC reported 2 more outbreaks in long-term care homes. We know the situation, especially in Quebec and Ontario, is very serious, where premiers also sought the help of military. So, of course, there has to be a lot of precaution that needs to be taken in place before we can allow access, while it's very important, because, of course, it's a difficult time for our seniors there. But I want to ask you about some announcement that you made of additional funding for a telephone and an online helpline for family caregivers of seniors. Tell us more about that.
Yes, this was the province of British Columbia has effectively doubled the funding to the family caregivers of BC, which is a province-wide not-for-profit organization that supports family caregivers through a number of helpline sessions in the community. It's not the direct substitution of the care that family caregivers deliver. It is a support for them, because, we need to remember something, that a lot of focus, rightly so, has been on the healthcare workers, the people providing the professional care for our seniors in long-term care homes.
Yes.
But the majority of care for seniors in this province and this country is delivered by family caregivers. They are, in fact, the backbone of seniors care in this country. And COVID restrictions are going to place an added burden on our family caregivers. So in British Columbia, for example, we have had to close our adult day programs for obvious public health reasons. Well, now somebody who got relief 1 or 3 days a week by sending their husband, wife, mom or dad to adult day program isn't going to have that relief anymore. Some who might be able to find a week or even a month of respite by mom or dad going into a care home aren't going to be able to find that relief right now, because we aren't making those kinds of admissions to care homes right now. And even in-home care is more limited. So we know that as time marches on, and as we continue, as the weeks turn to months under these COVID restrictions, these burdens on family caregivers are going to increase.
Right.
And I know that what the relief that they really need and the relief that they really deserve is to have relief from the caregiving duties they're performing and to get some time to themselves.
Right.
And I'm so sorry that we can't do that for them right now because of the COVID restrictions. But what we can do is we can give them an opportunity to reach out, to know they're not alone, to connect them with other family caregivers in the province, to share the burden, and to be able to know that there are many people out there who know what they're going through.
Very important points being raised there by you, Isobel. BC Seniors Advocate Isobel Mackenzie, thank you so much for joining us on CTV News Channel.
Thank you very much.